Hi, I'm Dr. Tim Grace. I had a patient come in the other day asking me what we could do to help them with their ugly, painful toenails. It gave me the idea to do a video that might help others understand what some of their options are. Ugly toenails can be frustrating, not only because they don't look good, but as they get thick, they can also be painful. There are many patients who are dealing with this type of a problem. So what do we tell them? First of all, what is a toenail fungus? A toenail fungus would be similar to an athlete's foot infection that you would get on the skin, but now resides in the toenails. As that fungus grows, it becomes discolored and thickened, often causing pain. What do we do to treat this toenail fungus? There are three basic categories of treatment. The first being topical application of an antifungal medication. This needs to be applied twice a day, morning and night, for at least a year. Second category is oral medication. Oral medication is fairly effective, but there are some risks or some health concerns with using the oral medication. The third treatment would be laser treatment. Safe, it's effective, and there are not side effects or concerns with its use. So sometimes after offering these three options, the patient will know what treatment they want to do. When the patient asks me what treatment I would recommend, I certainly recommend the laser treatment. It seems to be, in our experience, the most effective and the least time-consuming for the patient. Patients will often ask about the topical medication. Who wants to do that twice a day for a year? Most patients don't. Why not use the oral medication? Most patients are concerned with the possibility of liver side effects or problems. There are several tests that have to be performed. A specimen of the nail has to be sent to a pathology lab to confirm the fungus. There's a blood test that has to be done before the start of the oral medication, and another blood test that has to be done after the first month of using the oral medication. Quite frankly, most patients are not interested in the possible liver side effects or problems. How does laser work? Laser is an easy treatment. It's one treatment a month for 3 months. When you come into the office, you'll be here for about 15 minutes for each of those treatments. Let me take just a moment and show you how that treatment is done. A handpiece directs the laser into the nail and is gently moved across the nail until the appropriate treatment is provided for each of the toenails. So how long will it take to see any change with any of these treatments? Well, consider the fact that it takes about 6 months to a year for a toenail to grow from the nail root to the end of the toe. So most feel that it takes about a year to ensure whether we've had a good result or a positive outcome with any treatment. With it taking 6 months to a year for that nail to grow out, it's usually a good 3 to 4 months before we see any changes in the toenail, regardless of which treatment is being used. So if you want to get those toenails looking good for summer or sandal season, you'll want to get started as soon as possible. You'll probably still have some questions, and each case is a little bit different, so come on in and we'll discuss what is best for you.